do you not know where the source of this Avalon cluster was? It's been about 2 weeks now, and you still don't know. Are we ever going to find out the answer?
So we're pursuing a lot of avenues of inquiry. So we have the sequence data on the Avalon virus strain, and we know that it matches most likely of US origins. We know that there was one person who arrived from overseas that was in hotel quarantine that had a close, not absolutely identical, a similar strain. So that's obviously a line of inquiry. You can imagine that we are doing a lot of testing, and sometimes we will never be able to definitively conclude that, because people clear the virus, and if you've cleared the virus, we then are basing it on serological studies, and we can never then check absolutely the virus strains and compare them. When people have very old infection, we sometimes are not able to isolate the virus. So we are working as hard as we can, and I just again want to thank the laboratories who have been sequencing over the weekend and doing all of that hard work in terms of helping us with the serology to pinpoint the source of this investigation. We probably have 10 or 12 line of inquiries. We open up a line of inquiry, we close it down. New information comes to hand, and that's why we're asking the community, anyone who was at the BELROSE Hotel for the whole month of December, if you had anything that could in retrospect have been a COVID-like symptoms, come out and get a test.
If somebody had it early December, they've cleared it, can you still detect that if they came and had a test?
Some people, not everyone, after infection develops serology, but clearly we also know our testing is quite sensitive. So this is not perfect, but testing people who have been in there in December, if they've got a recent infection, we may well pick it up. But also if it allows us through our records to cross-check people that might have been at the BELROSE Hotel and then at other venues of interest, we may be able to ask those individuals to assist us with serological collection. So if we find some avenues of inquiry that we want to pursue, can I just again say people have been amazing in cooperating with our investigation.